Hello, happy Friday. Let's advance pharmacy practice in 2021 and build on this momentum for the role of pharmacists that was really emphasized in this crazy year of 2020. I do find that looking at case studies is a great way to give you ideas for your situational analysis to plan for your future innovations in your own practice. You know, I've talked about the fact that innovation is not always about that brand spanking new total innovation, which I would love to create full transformative innovations. But many times we have to keep up with the other great ideas that are out there already being done by our colleagues. And this week, I just finished attending the ASHP major clinical meeting, and I had a chance to listen and learn from those who have been awarded the ASHP Best Practice Award. And a lot of great innovation there. I'm just going to briefly go through them. You'll have a chance, of course, on the ASHP website to read more, and they'll be published in the AJHP journal. I just want to highlight them today for our discussion of Pharmavation Friday. Welcome to these connector dots. These are these brief candid insights on healthcare, pharmacy, and life for connectors and pharmavators. And I'm your host, Kimber Booth. I am a pharmacist, strategic consultant, and I help pharmacists to advocate for roles and resources to advance pharmacy practice and have engaging careers. So let's talk about, there's 4 Best Practice Award winners that I want to share with you, and they span the country. So I'll share a little bit with you. I won't be able to, I won't say all the names of the authors here, but I'll definitely try to put them in the chat of the post where you're seeing this afterwards. So the first one was Advancing Pharmacy Practice in a Rural Setting. This is the Northern Navajo Medical Center in New Mexico, and Kevin McDermott was the lead author. What they did there was they really assessed where pharmacists can really work more as primary care providers to assist with the shortages that have been seen in the recent years and look at our scope of practice. They granted additional diagnostic privileges to the specialty trained pharmacists, like we do see in typical collaborative practice agreements. And to prepare the pharmacists for some of these activities, which we may have learned about in school, but it may have been a while, they created a physical assessment training course. And so they've been able to show that pharmacists can really act as workforce multipliers within different specialty cares. And the main area that they did this was with epilepsy and rheumatoid arthritis. So they were actually doing some of these physical assessments that are needed to monitor these disease states. So congratulations to the Northern Navajo Medical Center. The second recognition that I wanted to share with you from these awards is the development outcomes of an innovative partnership between a health system Department of Pharmacy and external community pharmacies. This was UNC Medical Center, Chapel Hill, and Mary Haston Vest is the lead author. So we recognize that the relationship between community-based pharmacies and health system pharmacies sometimes creates some challenges. Many times we are working in silos, and even sometimes we may be seeing each other as competitors. But UNC took a broad approach and worked with the group, which is an excellent, innovative organization for independent pharmacies, and that's the Community Pharmacy Enhanced Service Network, or CPESN. So what they did was they developed a scalable model to improve transitions of care from their hospitals to the community for the patients that were shared between the health system and the community pharmacy. And they tried multiple ways to do this, and they leveraged data analytics to both identify those patients and to share and communicate about the patients using the electronic health record. So they looked at patients who had been admitted to the medical center and who used one of these partner pharmacies. They were successful in acquiring the limited access to the EHR by the community partners, which was helpful. Of course, that's always been a barrier when you look at this relationship and the challenge that community pharmacies have not tapped into accessing electronic health records, or they just aren't able to do it. So this level of access allowed the community partners to read the data in the electronic health record, and also actually allowed for the secure communication about the patients between the teams, allowing the direct messaging within the EHR platform. They were also able to further enhance that by actually allowing the notes from the community pharmacist to be included in the patient's medical record. I don't actually know which electronic health record this specific health system had. I'm aware of what CPESN uses for their community pharmacies, but I'm not sure about this health system. So I'll definitely be looking into that and hopefully share this on my website. So this definitely, led to additional improvements in patient care. What they did was they documented what they refer to as the medication therapy problems, which is definitely a common way to document issues with medication regimens. And they were able to have this positive implementation and also were able to survey all the stakeholders involved. So congratulations to UNC. The third award from the Best Practice Awards was establishing an opioid prescription stewardship program utilizing education and machine learning. And this was through Lifespan Rhode Island Hospital in Providence, Rhode Island. And Ashley Remay is the lead author there. So this was a great initiative utilizing artificial intelligence and a new system to look at detecting diversion and managing opioids. So of course we know that detecting diversion and overuse of opioids has been a major problem, and definitely came to the forefront in these last few years, and especially as we've seen some of those lawsuits being settled. So we as pharmacists and medication experts want to continue to help in this realm, and so they utilize this tool to help with controlled substance stewardship. So it was definitely a multidisciplinary initiative, and they worked both on the regulatory and the clinician side to work on this tool. And it uses machine learning algorithm to predict the likelihood of prescribing an opioid prescription and compares that to the presence of a prescription on a patient encounter. So when they were able to look at the department trends, after implementing this, they were able to show that they were able to reduce the, what we refer to as a major endpoint here is the morphine equivalent daily dose. They were able to reduce that. They also were able to increase naloxone prescribing to reduce those endpoints, as well as decrease the opioid and benzodiazepine co-prescribing, which we know that is like a double whammy when it comes to the safety for these patients. So they also basically supported this by educating their 240 physicians and 300 residents and fellows through this implementation of this process. So very exciting, positive endpoints there for utilizing artificial intelligence. And definitely, when I talk a lot about, advocating for roles and resources when it comes to, advancing pharmacy practice. And this is definitely one of those things that is a clear resource. We need to advocate for new technologies where appropriate, not chase the latest shiny object, but if it has meaningful outcomes, we need to put these things in place because we can enhance our ability to provide care and keep everybody practicing at the top of their licenses. The last one that I want to share with you is the impact of a novel diabetes stewardship pharmacist model on enhancing inpatient safety and outcomes and cost avoidance. And this is from Nebraska Medicine in Omaha, Nebraska. And John Kinovich is the lead author here. So we know this whole topic of pharmacist stewardship is important, and I do love this term stewardship. And it started with antimicrobial stewardship, and then we look at it for anticoagulation and formulary stewardship and other ways. It's just a good term that helps to describe what we're doing to kind of be good stewards and manage these resources that we have for our patients. So we know that diabetes, though, is of course one of those top 3 high-risk drug classes in helping to manage those patients. So what they did was they created a novel role as a diabetes stewardship coordinator back in 2016. And their goal was to improve safety, decrease patient harm, and enhance education and optimize their glycemic management on the acute care side. So this is an acute care initiative. So what they did, what they found results in safety with was centralized monitoring of all the inpatients as a critical step. And they had the electronic glycemic focused patient safety specific dashboard as tools for this centralized position. They found that the most common intervention that pharmacists had to follow up on was adjusting insulin regimens when the blood glucose was higher than 180. And if we can do that intervention, that will avoid that clinical inertia that can happen in the inpatient safe setting, and of course, avoid those complications and other poor outcomes that happen when patients have hyperglycemia in the hospital. So when they looked at this, at the outcomes measurements of their study, they did show that, using this patient stay blood glucose as the benchmark in the critical care and non-critical care populations, they saw a 65% reduction in blood glucose readings that were less than 70 in the critical care units and a 50% reduction in the non-critical care units. So this translated to a cumulative reduction in 0.46 days in length of stay and greater than $697,000 cost avoidance annually. So obviously a very good outcome here. And this is, an example where, if we can really show this as a hard endpoint, ideally on that return on investment that they calculated, these are definitely good measures to have to justify resources, because I know it can be difficult sometimes to justify positions when you don't have a clear endpoint. But if you can truly show a reduction in length of stay and a true cost, a direct cost savings by reducing that length of stay, that can be beneficial. So now it's your turn. What innovation has your department implemented in 2020? So share your thoughts in the comments, or maybe there's something you're planning for 2021. I know we've had to do a lot of innovative things related to COVID, and I'm sure more of that is planned for next year. So as always, I do want to, wish you happiness and healthy fall here, and as we move into the winter. Please join me for these future connector dots. Usually do them around 5:15 Eastern time, or you can also access the library of these at kimberbooth.com/dots. I leave you with be bold, be a connector, advance healthcare and pharmacy practice. Thanks so much and have a wonderful weekend.